Hi everyone. I was just thinking about the future of AI in medical field. I was just thinking, see, I'm a doctor. For the last 5 6 years, I have read all the books related to all the 1920 subjects in my MBBS, and now presently I'm doing anesthesia, and now I am reading books related to anesthesia. Now, what impact will AI do in my field? Basically, one patient comes to me, he tells some certain signs or symptoms, some certain symptoms and signs will be there. I analyze those things and I integrate all those symptoms and signs with all the knowledge which I have gained in the due course of 8 years, 9 years, 10 years, or 12 years. I analyze these things, integrate that knowledge with those symptoms, and with my experience, I reach certain diagnosis. And accordingly, I have also read the pharmacology and I have practiced it. So, accordingly, I write the prescription and I treat the disease. So, see, if I have accumulated the data for the last 12 years and I'm remembering it. See, data I read it from the textbooks. Like for pathology, standard book is Robbins. For medicine, it's Harrison. So let's assume Robbins is around 1000 page, Harrison is around 4000, 5000 page. So basically, what am I am someone who is remembering the data, analyzing the data, processing the data, interpreting the data, and then solving the diseases, right? AI can also do this, and AI will do it better than us. In fact, see, if I'm an anesthesiologist, I got trained for some 8 9 years now. But let's assume if ChatGPT, if I get all the PDFs of all the books which I have read in the last 8 years, and if I make a project, if I upload it, ChatGPT can merely just do it in 1 hour, 2 hour, 3 hour, and it can be R par with me. It can, so it can be almost equivalent to me, and if proper prompts are given, it can give the results what a trained anesthesiologist can give. So, and I think AI can do it better than us. So the question is, will it replace anesthesiologist or a doctor? I somewhere think yes, because with with if we think from, if we think about India, yearly 1 lakh doctors are coming out, and out of those only hardly few percentage of doctors are skilled and intellectual doctors. So others are substandard doctors. So AI will replace all those substandard doctors, and they will aid the skilled intellectual doctors to treat the mass patients in a better way. So presently now, skilled intellectual doctor is treating 10 patients at the same time, and one unskilled doctor is also treating 10 patients. In upcoming days, that unskilled doctor will be replaced, and one trained skilled intellectual doctor will treat both, even the patients which that unskilled was treating, with the help of AI, because his time is saved, energy is saved, and with the advent of internet, he can treat any patient from any part of the world. Even the Elon's Optimus, he's training, even he says that Training a surgeon takes years together. Optimus can get trained in few hours, few days, or within a year. So I think near future, it's going to disrupt the health care facilities, and I think this should happen, because only then the costing of all the healthcare facilities what is happening now will get reduced. If now what these Chinese people are keeping a small booth like hospitals, in airports, malls and all, where the patient enters the booth, he gets scanned, like MRI extent scans, and all the vitals are taken, all are given to the AI, it interprets, it gives this prescription within the minutes. This will reduce the cost from patient point of view. No doubt it will hamper the doctor's earning, I agree with that. But and the charm, the glow, the glamour with respect to this health, with the doctor, which is connected to this doctors will go off, I agree. But accessibility of healthcare facility to each and everyone will become easy, I feel. So yeah, I think in future AI will disrupt this the way Palm Med, and this has an Nvidia CEO said that radiology doctors will be replaced. My thoughts are also my thoughts also align with that. Many doctors will be replaced with AI. Not only that, most of the white collar jobs will be going, and we might see and we will see the boom of blue collar jobs, I feel.